to the morning meeting of the Lane County Board of Commissioners for August 18th, 2020. We have a pretty full session today. Commissioner Farr is on the phone and he will be able to join us perhaps in and out today. We have a 10:15 time certain. We do have an executive session in the afternoon, as well as an evening public comment session and equity and access listening session. So we'll try to keep the meeting moving today. The first item on our agenda is adjustments to the agenda, and looks like staff has pulled item 12A, from the agenda, and we'll pick that up at a future date. Is there any other adjustments to the agenda today? Okay, hearing none, we'll move on to emergency business. Is there any emergency business today? Okay, I see none, hear none. We'll move on to public comments, and I'll just state my brief intro that I do each morning. So in this virtual format, for the public that you're watching, when you are registered to watch the meeting, you're registered in our system as attendees. Attendees are webinar participants who are simply viewers of the meeting and audience member. Your microphone and your webcam are automatically muted as attendees. However, when we do public comment, as we are now, when you are ready to speak at public comment, please raise your virtual hand and you'll be recognized. You only need to press the hand icon once. When it begins, I'll send this over to our moderator to facilitate. We usually give people 3 minutes to be able to do their public comment. If there's a lot of folks, we may have to limit the amount of minutes per person, or we'll need to do some kind of other way in which to pick people out. Sometimes that it really is only needed if we don't have enough time. We haven't had to do that so far. So if we need to limit or reduce the time allotted, we'll let you know. Or if speakers need to be picked randomly, we'll let you know. So at this time, I'll move it over to our moderator for public comment.
Thank you, Chair Buck. At this time, if you have registered for the meeting and you would like to present public comment, I would ask you to raise your virtual hand. There should be a button on your device that looks like a hand, and if you can press that only one time, I will see your hand raised and I will call on you to speak. I do only show one person has registered, and it's a Mr. Lee Bliven, and I do believe you want to give public comment, but your hand is not raised. So I will go ahead and unmute you. Now it is. Your hand is now raised. I will unmute you and I will begin the timer and you may begin your public comment. One moment. Mr. Bliven, you are self-muted. If you can unmute yourself, you may begin your public comment.
Okay, can you hear me now?
Yes, we can.
My name is Lee A. Bliven II. I am treasurer for CareWorks of Lane County, also with the Eugene Springfield Solidarity Network. And we are concerned about the shortage of proper personal protection equipment, PPEs. Supplies for caregivers and care receivers, many of whom are at high risk of developing COVID-19 because underlying medical conditions for themselves or the people they live with. My wife, Susan, and myself are both disabled, and we are in the very high risk category. Susan, disability requires fairly high level of care, including dressing, toileting, cooking, and most of their daily activities. We have a state caregiver, paid caregiver, who comes in to assist her. We've had to reuse masks and gloves. We could not, because we could not find supplies. putting us and our caregiver in even higher risk. When we have been able to find PPEs, we have been forced to pay for them out of our own pocket. We are on fixed income, and this is a burden. In addition to the expense, I am forced to further expose myself to the COVID-19 and search for protective equipment, putting me at higher risk of developing the COVID symptoms. I've recently developed a non-COVID-19 respiratory infection due to being exposed to outside exposure. Both Susan's caregiver and I contacted Aging Disability Services and Home Care Commission to try to get supplies. We've had no response. We've tried several times and still no response from any agency. The county and state have promised that these supplies are available. Where are they? These PPEs aren't available. I have heard from other caregivers and families who have the same problem. I know of one caregiver who has 2 people she takes care of, and they were only able to get 1/3 of the supplies that she needed, which puts her and the people she cares for in jeopardy. Caregivers and their clients need to know who's responsible for getting information on receiving PPEs out, who's responsible to flag PPEs, who can caregivers, let's see.
Mr. Bliven, your time has expired. If you'd like to wrap up with a final comment, that would be fine.
I'm done.
Okay, thank you. Chair Buck, at this time, we have no one else signed up for public comment, so I will turn the meeting back to you.
Okay, thank you for calling in and sharing. Is there any commissioner response this time? I don't see any, and hopefully to respond with some information about his experience when we get to our next item. Commissioner Bernie.
Chair Buck, this is Commissioner Farr.
We'll do Commissioner Farr on the phone, and then we'll go to Chair Bernie, Vice Chair Bernie.
Thank you, and I apologize if I step in. This is not a remonstrance or a response. It's an item, if it's okay to mention a brief item at this point in time, Chair Buck.
Sure.
Thank you. The Lane County has an Equity and Access Advisory Board. We know that is advisory to the county administrator. It was established, I believe it was 4 years ago, perhaps 3 years ago, and there's a board that consists of selected members. They're not appointed by the Board of County Commissioners. I think we all know this. They meet regularly once a month. I typically attend their meetings as an observer, not as a participant. And at their last meeting, they ratified and sent a letter to the sheriff, to Sheriff Harold, requesting an inventory of what are called 1033 items. That is military surplus items that have been given to Lane County Sheriff's Department. And I will say that the sheriff is in the process of compiling that list. And I believe that their request is that he give it to them on their September 2nd meeting. And I'm certain that I cannot speak directly for the sheriff. He's a separate elected official, but he is compiling that list, which is relatively easy to compile. But at the next board meeting, a week from today, I hope to and expect to ask the board to give me head nods on requesting that the sheriff provide more than a simple inventory of the items, that the sheriff provide any use that any of these items may have been used for, also any use that they potentially could be used for in the future, and any surplus items that is unlikely that the department would ever use, and a pathway or a way to dispose of the items. Now, the 1033 items include things like weaponry. It also includes things like the rescue vehicle that they use during negotiations. It also includes things like night vision goggles. I've talked to the sheriff only briefly, and he's aware that I may make that request next Tuesday to expand the response to the Equity and Access Board and to provide a report to the Board of County Commissioners exactly what these items are and what they may or may not be used for. Thank you.
Thank you. Commissioner Burney.
All I was going to say was, Mr. Biven, I thank you for your input, and I encourage you to stay on and watch, because our next agenda item is going to be a COVID-19 sort of report to the board, and I hope Ms. Gaffney will directly answer your concern that you articulated. Thank you.
Commissioner Bozovich.
Thank you. I just want to say that I'm extremely disappointed in the emergency board's actions yesterday in choosing not to provide local governments the COVID relief funds that were designated to them under the CARES Act. If we were provided those funds, we might have the local ability to respond locally to needs like Mr. Bliven's need. But the state is choosing not to provide those funds as they were provided to Portland and Washington County up front with very little strings attached other than the limitations in the CARES Act and the federal guidance. And I am really disappointed that some of our local representatives chose to vote to spend that money, quote, on our behalf. So yeah, we should be getting our share of over 400 million in funds, and the state is choosing to hold on to those. And in addition, took 105 million of that and spent it themselves on our behalf. And I'm just really disappointed in that. And it speaks to our, lack of trust in local government to understand what we need locally here on the ground right now by the state.
Any other remonstrance? I'll just share that I appreciate that comment, Commissioner Bozovich. If you may recall, while we've had some down weeks, the mayors, former Mayor Lundberg, Mayor Venus, and myself did do an op-ed regarding that issue. It was previous to their latest e-board meeting. It was intended to be informational item to the public, so they know exactly how much money we were getting versus the Portland metro region, and it is completely inequitable for those smaller and medium-sized counties and cities. I do hope in the future that future congressional CARES funding package comes our way and it comes directly to cities and counties. Okay, if there's no more remonstrance, we'll move on to the COVID-19 response and recovery item. We have with us Mr. Milka Heiske, our administrator, and Karen Gaffney, our Health and Human Services Director.
Thank you, Chair and Commissioners. I'm going to kick this off, and I think, Diana, if you're able to pull up, I think she's going to try to pull up this plan. It is posted on the website, linked to this item, so the public has the ability to see it. This is what the plan looks like in front. I'll walk through some pieces of it and do some highlights, and then
Mr.
Karen is going to.
Diana, for a moment.
Go ahead.
Ms. Gaffney, I changed the presenter to you. Do you have that document, or would you like me to take the presenting back to display that document?
I can pop that document up if that's easiest, and then I'll have it when Steve passes it over to me.
There we go.
Do you have one that was posted today?
I believe so. Diana,
Okay.
if you would rather do it, I'm fine with that.
No, I just wanted to make sure you had the right version. Thank you.
Okay, so Karen will pull that up, and I'll just walk through a few things for you. So this is I think as the board knows, we've had an incident action plan, and I'll touch on this in a minute, that we update weekly. It's a 30-page document This one is an older version, but it was July 27th of 2020, just before our last board meeting. 31 pages, I think it is. And it's a really lengthy, detailed document that goes through very specific tactical items that our emergency response team for COVID-19 response is focused on. Again, it's updated weekly and signed by, ultimately approved by the incident commander, Ms. Gaffney. What we wanted to do here is take that information and put it into a more of a policy and public document that's easier to track and follow and has these high-level priorities, strategies, and then some specific goals as well as measurements that we're using. So we're going to walk through all of that. I wanted to just start with a brief timeline. I know the board has heard this and we included it in the budget message, but for those who weren't tuning in for the budget message, we'll include that now as well. And I'll just show you on the first page of this plan and I'll note that this version of the plan is 8 pages long. So it's about a third of the incident action plan. And I think more readable and consumable for the general public. On the first page, we walk through a timeline, and I just want to touch on a few things here. We note that response efforts really have been aided by early, consistent and aggressive approaches by local and state governments. Lane County on January 22nd, the day after, January 22nd, 2020, the day after the first case of COVID-19 was reported in the US, Lane County held its first coordination meeting with the Oregon Health Authority to begin preparation for response to this. This was back on January 22nd. Then on the January 27th, we had a partner coordination meeting with Peace Health and the University of Oregon. On February 6th, we stood up our incident command system and emergency operations center. March 2nd, we opened a joint information center and held our first daily press conference. March 3rd, we held our first daily healthcare provider call. March 8th is when Governor Brown declared a state of emergency. March 17th is when Lane County had its first positive COVID-19 case. So we began our planning and response efforts almost 2 months in advance of ever having a positive case in Lane County. March 23rd, we continued all of this to open our personal protective equipment donation center at the Public Works Warehouse, opening respite sites in late March, and so on until today. So I'm not going to walk through all the timeline through July and up to mid-August where we are today, but I wanted to just reflect a little bit on the timeline and history of our early response efforts and our deployment of the incident command system structure, emergency operations center, joint information center, call centers, all of these things that are national and international best practices for responding in a coordinated way to emergencies in our communities. A few other things I'll note, in addition to the nearly 50,000 tests that we've conducted in Lane County, and you see that our testing numbers continue to go up on a daily basis, we're trending more towards the 700 to 800 tests per day. 500 was our minimum goal. 1,000 is our ideal goal, and it's our plan to get there in the near future. We've had over 1,300 individuals under monitoring, and of those, since this began, of those individuals under monitoring, 116 have ended up being cases. This is through our contact tracing. So these were proactively identified individuals that originally, many of them originally did not have symptoms or didn't test positive. We've had 63 targeted testing events in Lane County. We oftentimes call these surveillance testing events. So these are the proactive, targeted community testing events that we hold in addition to, while the hospitals and clinics and private labs are conducting more responsive testing to people who believe they've had exposure or have symptoms, Lane County Public Health has been responsible for conducting these proactive surveillance events. So we've held 63 of those to date. 3,000, it I think did we have one last night in Coburg? Is that right?
We have had one this week in Coburg, yes.
In Coburg, yeah. So maybe it's 64. 3,101 tests administered at those events. So over 3,100 tests have been administered just at those 63 surveillance the testing events. 22 cases were identified through those events. So of those 3,100 tests administered at 63 different testing events, 22 cases were identified. 72% of those cases identified reported, so 72% of the 22 cases that were identified at those reported no symptoms at the time of testing. So those people likely would not have gone in to pursue testing if not for that surveillance testing that we've been doing. Our website views have averaged about 1,400 per day just in August. Our daily social media reach hovers around 2,500 per day. And I understand that we've had about 13,000 calls have been received as of 2 weeks ago at our call center. We're averaging between 300 to 500 calls per week at our call center. A couple other statistics I want to touch on the incident command system structure. And Karen's working through the plan here, and maybe just show the org chart, Karen, if you can slide down to that right there. This is a little hard to read, but if you can, just go to the org chart. And that shows you this structure that we have deployed that is it's called the incident command system structure. It's a tested structure that's used for things like wildfire response and major flooding or earthquake events. So public safety officials typically have deployed the incident command structure as a way to organize a complicated and multi-jurisdictional response to emergencies in a community that are intensive, that require a lot of agencies to collaborate together. This model was made for a global pandemic like COVID-19. We've used this model numerous times in Lane County for wildland fire responses and other events. We've deployed it since February in our response to COVID-19 in Lane County. So that org chart is included, as well as information about what's included in that process. And I just want to note that our ICS team, our incident command system team, conducts daily briefings. So they meet daily. They develop situational status reports twice a week. These are updates on case numbers and contact tracing and all of the areas that we pursue. We hold news conferences twice weekly. And then again, we update this 31-page incident action plan every single week. So it's reviewed and updated and adjusted and changed because the tactical items change each week. So this really is our sort of daily response plan that the team who's leading our effort, this IAP, Incident Action Plan, is what the team on the ground is using to guide its actions. This plan that we're sharing with you today is a higher level policy and public document to help all of us understand as decision makers and as a community our focus. And we'll talk about these 5 areas: containing the spread of disease, flattening the curve, ensuring healthcare providers, first responders, and hospitals have what they need, minimizing economic impacts on businesses and individuals, providing public information and guidance, and then preparing for the fall. Karen's going to walk through each of these, and then at the end of the report, so there will be some more detail on each of the 5 items. At the end of the report is what I think is really some, it's all incredible work by not only our ICS team, Karen and the folks that she's leading, but our community partners at the U of O and others. We've worked in collaboration with the University of Oregon to develop an alert level indicator matrix, and these 4 different alert levels, similar to as you would see for a wildland fire or wildland fire events or air quality monitoring, right? Where we're providing these, green, yellow, orange, red indicators based on data that we have available to us to determine how should we be acting today. When you see those wildland fires, say, what's the risk today? Low, moderate, high, extremely high. That changes whether or not you're going to, make a fire if you're out camping, or pursue other activities. So that's what the alert level, and Karen will walk through that. The last thing I want to note, a lot of talk about planning, and as important as planning is, and I think that our ability to manage COVID-19 to date in Lane County is largely due to the early and aggressive planning and response efforts by Lane County and our community partners, as well as our residents who have participated in following for the most part, following in our businesses and following the behaviors. So as important as all of that planning effort is, it's really also important for us to ultimately track the results. And so I want to just finally, before I turn over to Karen, note just on some of the results that if you look at really every objective measurement that we're tracking that is critical to understand the spread of the disease, the severity of the disease, the impact of the disease on different populations, our numbers have since the beginning of this, and continue to trend in a generally positive direction, and that's with an asterisk of as we head into the fall with openings of schools and everything. But we have remained below state and national averages. So to demonstrate that, I want to share, we've conducted over 50,000 tests in Lane County, or nearly 50,000 tests as of today in Lane County. And again, our daily average is trending up to 800. Lane County represents 9% of the statewide population in Oregon. So we have 9% of the statewide population, and we're the second largest metro area in the state. And we've conducted to date 10% of statewide tests. So we're slightly above the statewide testing numbers on a population percentage. Additionally, Lane County has 2.7% of total statewide tests. So 9% of the population, 2.7% of total statewide tests. We're 9% of the population. We have 1% of statewide deaths. We're 9% of the population. We have 0.05% of statewide hospitalizations. And finally, Lane County's total cases per 100,000 population has averaged 17 for the past 3 weeks. So per week, 17 for the past 3 weeks is the average, while the statewide average is 53. So we're significantly lower than the state average on cases per 100,000. And Lane County's test positivity rate has averaged 1.6% over the past 3 weeks, while the statewide average is 5.8%. So our test positivity, 1.6%, statewide average, 5.8%. So by all objective measures, the results to date are I think we're hopeful and cautiously optimistic about our ability to continue to manage this with some significant challenges ahead that we'll talk about. So I'm going to turn it over to Karen to walk through those 5 points and then our alert monitoring.
Okay, and Diana, I know you are controlling the screen, which is great. Could you scroll back up to the one pager? Let's see, Diana. Maybe we've lost Diana.
I'm getting it, Karen. Which one pager?
It's just earlier in the plan. It's Lane County's COVID-19 response plan. Just if you scroll back up the document. There you go. That's the one. Okay, thank you. And I know we have limited time this morning, so my goal, Steve did a great overview of our plan. So I'm going to focus on a couple key areas that he didn't have an opportunity to talk about and want to walk through those, and then make sure we have enough time to give you actually an update on the situation, since I know the board has been down the last couple weeks, so we have some information to report as well. So this document should be a familiar format to each of you on the board and our staff and community, because it's really similar to how we've done a one-page summary of the county strategic plan. So this page shows those same 5 strategic priorities that the county administrator walked through, and then the specific strategies associated with each of those, and ultimately the measures that we are tracking on our website and what we'll report to you. This structure is what you can anticipate will be our reporting structure for these reports to the board, unless you tell us you need something different than that. Again, the strategies should also look familiar, because it's the work that we've been doing for the last 6 months, as the county administrator outlined in his overview. So our first priority is to contain the spread of disease, flatten the curve. And so in that particular item is where you will see our strategies around basic hygiene and mask wearing, knowing that higher risk individuals need to stay home and stay safe. Our testing efforts are associated with that particular priority. The contact tracing, investigations, isolation and quarantine. All of those strategies are the efforts we bring to bear, specifically with the goal of flattening the curve. The second priority is to ensure that our healthcare providers have what they need. And so in that bucket, you'll see our role and responsibility around being the PPE clearinghouse in the community and making sure that we distribute that PPE according to state and federal guidelines. We also spend significant work with our provider community, both problem solving and innovating. Those are things such as our twice a week provider calls that Dr. Pat hosts with the community. And then finally, also coordinating those scarce healthcare resources such as ICU beds, ventilators, and PPE. We have an ongoing role in the community, not only to evaluate supply of those, but then if we do have a surge and there's concern, making sure that we're working with our hospitals and providers to coordinate access to that. And I'm sorry about the screen. I know Diana's doing her best to get the document up, and we'll keep working on that. And I will say this is also posted on our website, so both at the board agenda packet and also on our COVID website. So the third strategic priority is that work that we've been doing to minimize the impact of COVID on businesses and individuals. We know that this virus is going to be with us until we get a vaccine and a reliable treatment. So part of our work out of our Emergency Operations Center is to minimize the impact on individuals and businesses. So in this particular priority, we have our strategies around small business grants and loans, and the work that Austin Ramirez has been leading in making sure we connect businesses in our community to those resources. The second piece is coordinating federal and state aid. In particular, we've looked at rental assistance aid and low-income energy assistance, and that particular process moves through the county and our emergency response out to individuals in the community. But it also includes all of the other federal aid that's coming to the state and ultimately out into the community. And then finally, sharing information and resources for those who are most vulnerable in our community. Our fourth bucket is that key piece of public information and guidance. This morning, I was listening to a story again on how we do behavioral economics and really shift people's behavior, which is what we want in that first strategic priority. So here in number 4 is where we bring all of our resources to bear, both to provide access to information and key messaging. That includes our call center. County administrator talked about the number of calls we've answered since that call center opened in March. And we continue to operate that from 8 to 5, Monday through Friday, to be able to not only answer general COVID questions for the community, But we also have nurse staffing there, and it's been a great help to our provider community as a place to have symptom questions answered. We also have been doing media updates. The county administrator talked about how we do pressers twice a week, and then collaborating with local community organizations has been a key piece of this work. So that means both in general messaging as well as culturally specific messaging. We've had great partnerships with our community-based organizations in the Eugene-Springfield area and in rural Lane County to make sure that we have effective messaging to people throughout the community. We've recently supplemented that messaging with paid advertising, particularly focused around mask wearing. And then timely data has been a key part of our response since the beginning. We know that for people to trust the actions that Lane County is proposing in the community, we need to be transparent about what our situation is. So we maintain live data feeds on our Lane County website available to the community. And then finally, the fifth priority is one that has emerged more recently as we start to look to the fall and winter. We know schools are a key piece of our community health in general, and so we support those efforts both through twice a week phone calls for public and private K-12 schools, and also by providing review and feedback for plans for reopening. Same is true for higher education, both our public university, the University of Oregon, community college, and then also private higher education institutions in the county. The third piece, we talked a lot about shelter in the spring, and we also have that high on our list for planning for the fall. And I know we had an opportunity for a work session jointly with the board and the City of Eugene City Council, really looking at not only shelter in general, but specifically in a COVID environment, how can we shelter people safely as we move into the bad weather? And then finally, this piece around flu and COVID. We have a predictable flu season that comes to us each fall. So we know there's going to be a convergence of flu and COVID. Our healthcare delivery system needs to be prepared for that. And then also within that, as we get flu vaccine out, we're also preparing for ultimately our delivery system for a COVID vaccine when that becomes available. So I know that was a lot of fast information. I'm going to pivot now from this, hopefully, Diana, to the very last page of the plan, which is the alerting system that the county administrator was talking about. And again, he stole my thunder in describing this as a wildfire alert system. I was up camping this weekend in National Forest Service land and drove by that great wheel that tells you what the fire danger is. And this is a similar tool for people who live in our community to have a sense based on data about what they can expect and what they should do to protect themselves and the community. So in the plan and you don't need to flip the page, Diana, but on the prior page, there are 6 specific community indicators that we are tracking data on. And that data gets updated at least weekly as it comes in. And then those metrics feed the alerting system. And Diana, if you can go back to that last page, please. And this alerting system then takes those metrics in a weighted basis and feeds what is our current alert level in the community. I will tell you right now, we're at a moderate alert here in Lane County, level 2. As the county administrator said, our data is much better than many places in the state of Oregon, and certainly better than places in the country. This dashboard was a joint project with the University of Oregon, who have been fantastic partners throughout this. At the U of O, in addition to these community priorities, they have established specific metrics for campus. And so they will have a U of O campus alert level that includes both these community data and the campus data. We'll do a formal release of the alerting system to the community next Monday and post these alerts not only on our website and the U of O's website, but also make them available in other places in the community. Again, to give people that sense, sometimes the amount of data points we have can be overwhelming, and this feeds it into an index that gives people an overall alert level. So that being said, what I would like to do now is just take a couple minutes to give you an update on conditions in the community, and then we will turn it back over for questions and discussion. I'm going to start by talking, and Diana, we don't need to share the screen anymore. We can start by talking about our work to contain the spread of disease. You can notice on our website, we now have, as of yesterday, end of day yesterday, we had 24 people who were currently infectious in Lane County, with a total since the beginning of the pandemic of 632 positives. We've had more than 48,000 people test negative for COVID-19 in our community. We currently have 1 person in the hospital and 4 people have passed from COVID-related causes. Testing has been a key part of our strategy from the beginning, and I want to let you know that we continue to increase the average daily number of tests conducted for people in Lane County. We are consistently exceeding 500 tests per day, and many days have exceeded 1,000 tests per day. The week of August 3rd, which is kind of our last complete week, we averaged 965 tests per day. So that includes, weekends, our numbers tend to be lower, so we're making up for those. Our positivity rate in Lane County for the week of August 2nd was 1.7%, with a case rate per 100,000 of 18. And those 2 metrics are key because they are a piece of what's driving school reopening plans. Just as a reminder, positivity rates need to be below 5%, and case rates per 100,000 need to be below 10. So those are the targets we have for those metrics. But also say, in terms of our ability to do appropriate contact tracing, we followed up with 100% of our cases within 24 hours in the last week of reporting, which exceeds our target of 95%. And we did have 34% of our cases in that week not traced back to a known source, which is not as good as we would like it to be. We'd like to have that number stay below 30%. In terms of our healthcare providers having what they need, I would say we're in very good shape there, and a piece of that is because our hospitalization numbers have stayed so low. We worry more about that pressure on the system when hospitalized cases are higher. I will take just a moment to respond to the person who had the question during public comment about individuals who also need access to PPE. I know, and I made a note to call LCOG to find out what supplies they're able to provide to people who are receiving services through their aging and disabilities system. I know the county provides services through developmental disabilities, and we are providing PPE to people in our system. So I'm hoping that maybe we can call over to LCOG and get some answers for the gentleman who provided public comment this morning about how to access affordable PPE for his situation. Third, I want to just talk a minute about our economic impacts, businesses and individuals. Again, we've talked about that for several weeks. We have, as of 9 o'clock yesterday morning, we've provided 395 households with over $1.1 million worth of rental assistance, and 988 households with $381,000 worth of energy assistance. So those programs are up and running, and we are continuing to process those applications for individuals in the community. And our business grant programs are continuing to move forward as well, both The phase one, approximately 75% of those dollars are out into the community, and then work on allocating our phase two dollars as well. Public information and guidance, I'm not going to spend a lot of time there today unless people have questions. I do want to just touch on schools for a moment in our preparation for fall. Yesterday was the deadline for schools to submit blueprints to the county and the state. And as of noon yesterday, we had 75 of those blueprints submitted to us, and our staff are working through each of those plans and providing input and feedback directly back to schools on their proposed plans. At least 10 schools have proposed to bring back K through 3 in-person learning under the county exemption, which they're eligible for because our positivity rate and case numbers are relatively low. So as long as they have an approved plan and no cases of COVID in their school community, then they would be able to do K through 3 in-person learning, and they're proposing to do that. And then finally, I would just say we continue to work closely with higher ed. I know that has been big on people's mind. Happy to answer questions. As the U of O is moving forward with their work, I know they have a significant meeting and announcement scheduled for this coming Monday, and I just want the board to know we are in regular communication with the U of O as they refine their plans for their distance learning as well as some limited on-campus instruction. So I think with that, Chair Buck, I will turn it back over to you.
Thank you both very much. So we have a little bit of time for some questions. Do any commissioners have any questions today? Commissioner Sorensen.
Thank you. Can you hear me okay?
Yes.
Okay. I have a question. I was just looking at the Lane County strategic plan this morning. And as you know, we adopted that back in December. And then COVID really began becoming more of an issue in February, late February, and then bigger and bigger and bigger. But there's no reference to COVID-19 in our strategic plan. And I'm wondering if the administrator or Karen could comment on whether they think it's something that's important that we should be working on as a county, and if so, why isn't it in the strategic plan?
Yeah, I'm happy to answer that, Chair and Commissioner Sorensen. I think the answer is because the board hasn't updated the plans, as you noted, approved the plan in December, and we have been focused on the response efforts and have not had an opportunity to bring the broader county strategic plan back to the board, but we certainly can do that. I mean, there are elements of our strategic plan. We have 4 strategic priorities: safe, healthy county, vibrant communities, robust infrastructure, people, and partnership, that certainly reflect the efforts that we're pursuing. In terms of a safe, healthy county, I would say COVID-19 response definitely falls in there. But you are right to say that and then we have things such as homelessness and community health and other things that are specifically identified. We don't specifically list COVID-19 response because we've been in the midst of dealing with that, and it happened unexpectedly. But certainly if the board would like us to bring forward a change to the countywide board approved strategic plan to reflect that focus, we certainly can do it. And I think that's an easy adjustment we could make.
Well, yeah, I just think that you're correct that, in the initial months of this, where the county is beginning to see the significance of it to the economy and to the public health of Lane County, maybe the general strategic plan of Lane County that involves public health, maybe that is sufficient. But as this is dragged on, and as the impact of this crisis is being felt in every aspect of the county, I think that we're now, 8 months into this, and that our strategic plan has to be meaningful. People have to look at it and go, oh, that's what they're doing at Lane County. That's what they think is important. And I guess I don't have any criticism that we haven't done this yet, but I think that if another few months goes by and we are still dealing with the level of infections, albeit low, but we still realize that this is having a dramatic effect on the economy, it really should be part of our strategic plan. And one way to make strategic planning meaningful is if people really rely on the strategic plan and are really trying to follow it. So I would just encourage anyone involved in Lane County's planning process to be aware that there is a big discordance between what we're doing on a daily basis and what our strategic plan tells the public we're doing. And to me, that's not a good situation. And my second question really has to do with the plan that you're ready to put out to the public. Is there a formal comment process on the plan, on the COVID-19 plan?
Queue, please, Chair Buck.
Yeah.
Yes, I
Are
have you next.
Yeah. I'm just curious about what involvement, if any, there is either with invited community members like people in the medical profession or a more general public notice that we are making a COVID-19 plan and we want the public's involvement in creating that plan, and this is our draft plan. Could you comment on that, Mr. Mokajski?
Sure. And, I would say that our Karen and the team, our incident command structure team, which now really is developing into 3 teams that are rotating every 2 weeks. And so we have, I think, around 20 to 30 people in our incident command structure at a time. I might be off on the numbers, but that's around what I think we're at. So, and we've rotated with 3 teams. So we have 1 team on for 2 weeks and then they go and then a new team comes on to maintain resiliency. Because folks, we've had a lot of people in Lane County doing work in response to COVID-19 for 6 months straight. And we've got to maintain resiliency. So we now have these 3 teams, a red, white, and blue team that rotate every 2 weeks. So we have anywhere, I think, between 60 to 90 people at least that are actively participating in our ICS structure and our response efforts. Those folks include medical professionals, physicians, nurses, epidemiologists, so on and so forth. And those folks are coordinating with hospitals and higher ed and other professionals to, as we mentioned, the coordination with the University of Oregon and developing the alert system and our coordination on their campus plans. So there's a lot of planning that's happening with various community partners, nonprofit, business, medical, throughout the community in developing both the tactical items that are identified in the incident action plan, the more detailed ground level work, as well as in these overarching strategies. In terms of, and I will say this, in terms of the county's strategic plan, not noting the effort on response to COVID, I'll take that one. That's my responsibility. And we will bring it forward to the board to adjust. I hope the board appreciates that we've had a default position of saying, we're going to tackle this virus and make sure that our community, our residents and businesses and the people of this community are safe and healthy, first and foremost. And so there's been a ton of planning effort that's gone in, as you can see, to the response efforts. And we missed, and I'm a big proponent of failing forward in calling out ways in which, well, we should have done this or we should have done that differently. So I'll own that one and say, yeah, we need to go and update our countywide strategic plan. And because it is the board's plan, and you're right, Commissioner, that it is, in order for a strategic plan to be relevant, it needs to be current. But I also hope that everybody understands that our default position we've sort of sacrificed the update of the countywide strategic plan because we've had a strong feeling about our need for active and aggressive response to this virus. In terms of public feedback, we certainly, the plan is going to be out there. So there's a ton of coordination with various experts in developing the plan and the strategies. In the public, we welcome the public to review and ask questions and provide feedback on that. And I guess that's what I would say about that. I don't know, Karen, if you have any other comments you want to add on coordination.
Thank you, Steve. I would add two things. First, I don't want to lose sight of the fact that this is still an emergency that we're responding to. So, the plan that Steve held up, the 30-page incident action plan, we are in emergency response mode, and I totally know this is longer than a dreaded snowstorm could be, or any of those other emergencies. But the situation on the ground continues to change, and part of why we included that piece in this plan around our incident action or our incident command structure is for the board to know that we have staff working 7 days a week in emergency response mode, and it continues to evolve, and that will continue to be true until we get a vaccine. And I appreciate the county administrator's remarks at the beginning of this item, really pointing to the results that we've been able to achieve using that method, and I feel really good about that. And of course, we engage with community because we wouldn't be effective at implementing these strategies if we didn't engage with community. So that has not been in the format of hosting lots of meetings to talk about what should we do. We're relying on science to tell us what the strategies are that will be most effective. But in terms of implementation, we've had deep engagement with community-based organizations, both those who we contract with and those who have helped host testing events, who have given us feedback about our Spanish language materials, the work that we're doing in the mom community, truly partnering with us in making this work happen. So we wouldn't be successful if we didn't do that as well.
Commissioner Farr.
Thank you, Chair Buck, and I appreciate that Commissioner Sorensen brought up the strategic plan. Been a little bit surprised by the nature of the response to his question. A strategic plan has strategies, of course, and those are revised from time to time. But our strategic plan, and I know this from experience, has dynamic tactics that are embedded in the strategic plan, tactics that adjust to emergencies and adjust even on a daily basis. They are a part of the strategic plan, and while they aren't written in the initial strategic plan document, they are indeed a definite part of the plan. We are engaging in tactics on a continual basis, and Mr. Mukarajski and or Karen, I'd like to respond to that, because the tactics that are embedded under Safe Healthy Community are a part of the strategic plan. They're not aside from, they are indeed an absolute integral part of the strategic plan which we have authorized. And the fact that we haven't changed the strategies is actually to our benefit, because you don't change strategies based upon on emergencies, even one of this magnitude. You embed the tactics in the existing strategies. Explain to me, please, how you've embedded tactics into our strategy of a safe, healthy community. Thank you.
I'll just make a, here's our one-page county-wide strategic plan, nicely laminated. You see these 4 strategic priorities. Safe, healthy county is one, and Commissioner Farr is accurate. We have these 4 overarching priorities, and we say protecting and enhancing the safety and health of Lane County residents with a focus on enhancing and managing resources, improving access to, prevention programs, and collaborative initiatives. That's our focus on, that's our strategic priority of Safe Healthy County. And so all of this work of COVID-19 response fits under a Safe Healthy County. And so we're empowered as a staff team to go out and do this response work and develop all of these plans, because the board has said, well, maintaining and enhancing the health and safety of our community is a top priority. So having said that, we certainly can update the plan and put a goal on there that says COVID-19 is something that we are focused on. But it's absolutely accurate to say that our current countywide board supported strategic plan is reflective of the work that we're doing in this COVID-19 response.
Commissioner Burney.
I must say,
Thank you.
I'm sorry.
And really, the dynamic nature of it is important to understand that on a daily basis, we cannot foresee exactly what we're going to need to do tactically inside of the strategic plan. Even before the end of this meeting, things will change. And I appreciate the fact that Ms. Mokraski, you and Ms. Gaffney, you have a team of professionals who are acutely attuned to the minutiae of the changes that are occurring on a regular basis. Thank you.
Commissioner Burney.
Commissioner Farr is more kind than me as my frustration builds. Here we're dealing with a county whose staff are on this thing, and I have some specific questions that actually relate to on the ground, not strategic plan. And the best we can do is talk about, hey, the dam has broke. We're trying to respond immediately. But by the way, let's think back and see how this relates to words on paper. I'm sorry, it's frustrating for me. I have some questions. Karen, you mentioned 10 schools have decided to begin reopening for K through 3. Is that correct?
Well, they have requested that in their plan, so they have an approved plan before they're able to open.
Okay, 10 have requested it. 10 out of how many elementary schools in Lane County?
I do not know the answer to that, Vice Chair Burney. It includes a number of private schools, so it's both public and private. So I don't know that.
Okay, and this isn't a criticism, this is just a discussion of the topic. It seems to me that if that's not broken down into public and private, and that's not in the context of the total number of schools in the county, it's difficult for me to interpret that information. So maybe we could get that. And by the way, any remark I have is in the context of my hat is truly off to all of you with the professionalism with which you are responding to this. I mean, if anyone wants to know the question, what happens when you don't have a coordinated federal response? You have a pandemic that you don't have a vaccine for. You don't know exactly where you are. And some communities are becoming incredibly hot, left to their own devices. This is kind of what happens. And our staff has been phenomenal. Having said that, I just read a Johns Hopkins Coronavirus Resource Center comparison of all states, not all counties. And I know Lane County is doing really good. But this thing, in terms of tests per 100,000, puts Oregon in the bottom 5 states in the country. Am I reading that correct? And if so, what do you attribute that to?
Thanks. And just before I answer the question, Chair Burney, Chair Vice Commissioner Burney, I'm wondering, is Commissioner Farr, are we getting the feedback? I know he wants to try and mute the phone, but I'm feedback on my end.
Yeah, there's a lot of feedback. So maybe if everyone can mute if you're not speaking, because it's hard to hear Kieran.
No complaint about hard to hear me, huh, Steve? Okay.
So in terms of testing volume, we know from the beginning that that's so critical to be able to contain the spread of the virus. And as a country, the U.S. has not done what it needs to do to get testing out there. And for us in Lane County, because we do not own our own lab, we have relied heavily on partnerships. And again, I'm going to do my deep appreciation for McKenzie-Willamette Hospital and the University of Oregon, who partnered to make testing available here in our community in ways that it isn't in many parts of Oregon. A week or two ago, we received a blast from the Oregon Health Authority that went to all counties, trying to help counties who could not get access to testing that was timely with other resources. And I had to hold my breath for a moment because they were sending out to other counties, McKinsey-Willamette as a resource, because we're able to get test results turned around quickly through them. And I'm eternally grateful for that. Our testing volume has been better than almost any other part in the state. And I know I've had questions from my peers in other counties asking, like, what are you doing to make that possible in your community? I think Oregon as a whole, in some ways, gets disadvantaged in terms of the supply chain because things are diverted to hotspots in other parts of the country. So I know that's a piece of the struggle that's happened for some labs, and there have been some close calls even with McKinsey-Willamette in having adequate supplies coming in here because other parts of the country are such hotspots that gets diverted. For me, and I think I mentioned this the last time we talked, the game changer that we will have in our community is when we're able to have a saliva test rolled out that will exponentially increase the amount of testing available in the community. And I remain hopeful that we will have that across the finish line before fall hits, and then I think we'll be at the place where you and I and many others want to be, where there really is just testing on demand and people can get those results quickly.
It also seems that even though the county executive started this by saying there have been 50,000 tests in Lane County, that kind of doesn't matter. This is my opinion. I'm ready to be told I'm wrong. It kind of doesn't matter at this point if those are old tests. You know, if some of those tests, people were waiting 7 or 8 days to get results back. I'm concurring with your point, Karen. My question is, at this point in time, what is is there an average turnaround between taking tests and getting results?
Actually, I looked that up because I have that on my dashboard. I don't have it top of mind. What I know is there's a significant difference depending on where you go for your lab results. That if you are at McKinsey-Willamette, through that, we're able consistently to get those results back in 24, maybe 48 hours. Their turnaround time remains really good. Some of the other labs send the samples out of state, and it ends up in a pipeline that's being fed from a number of places. And the turnaround time there can be much longer. It can be 7 to 10 days. And you're absolutely right. When we have that kind of a lag on results, it really undermines contact tracing, quarantine, and isolation efforts. But I can look that up for you because we have turnaround time by lab that we watch.
Thank you. And last statement, requesting maybe information next time. And thank you for your indulgence, Chair. I would appreciate, you mentioned economic impact, and you talked about rent subsidies, rent relief, utility assistance, all of those things which are so important. I would like to know, perhaps at our next meeting next week, rather than put you on the spot, what % of the people that requested rent relief that was able to provide? What % of the people that requested utility assistance was that being able to respond to? And how many dollars have come into Lane County to businesses? Because all those dollars, you can imagine the marginal propensity to spend is close to 100% when people are getting by. How many federal dollars have come to our county and been injected into our local economy? Thank you.
I think the feedback there is coming from your microphone, Commissioner Burney. I'm not sure why that is, but we'll just keep that in mind as we go forward. Commissioner Bozovich.
Thank you. And I just want to say that I really appreciate the work our staff has done to keep the numbers so relatively low against the average numbers across the state on all categories, as well as it's just the fact that our state is so far below national averages too. It just makes Lane County, at least on this pandemic, one of the safest places to be. And our staff has done a great job under a declared emergency, which you don't plan for emergencies, and that's why they're not usually in strategic plans. But once you declare one, it becomes a high priority. And having been part of ICS structures and was actually training to become possibly a planning manager in that structure, I understood all along that as soon as you stand up in ICS, there's a planning document that goes with that, that gets updated on a daily, if not hourly basis. So I always understood that there was a plan. Just plan in a jargon of ICS stuff and technical stuff, not easily digestible by the public. So I truly appreciate the work of staff to kind of take that plan and convert it into a more public document. And this is despite the fact that Lane County has only been promised $7.5 million of our COVID relief funds from the CARES Act on a reimbursement basis, while Portland has gotten upfront $114 million that they've already been able to allocate. And as you look at those strategic priorities that are in the new plan, think about what we could do with roughly 60% of this money, because if it was going to come down to Lane County at a similar percentage, we would get about 60% of this. They have put $58.5 million in household housing and homeless assistance. They put $15 million into small business assistance. They put $3.5 million into bridging the digital divide to help schools, and another $4.4 million to help arts and cultural venues. They put $30 million back into their public health system in direct response cost. So think about those numbers and think about 60% of that would be equitable in this area. And we're getting $7.5 million on a reimbursement basis. We have to come up with the money first. The E-Board has got to change this. And I'm really disappointed in Senator Roblin, Senator Manning, and Representative Holvey that all voted to approve that $105 million expenditure, quote, on our behalf. So, as you're thinking about this COVID response, how much more robust would our plan be if we had 60% of that $114 million? So I also just want to say, I know there's a little bullet point about planning for flu season, but everything we do to prevent the spread of COVID is exactly what we tell people to do to prevent the spread of the flu. Wash your hands, cover your cough. What do you think face masks are? That's about covering your cough and your sneezes that may sneak up on you and you don't get your arm up in time. That's really what that's all about. So it's interesting. We're planning for flu season and the intersection there, but it'd be interesting to see if we actually have a lower incidence of flu as people are doing what they can to flatten the curve for COVID. Which reminds me that I did ask for some information that still hasn't quite come back yet on some of the other mortality rates since the epidemic began. Curious about how our suicide rate is and our overdose rate. And then, of course, whether or not our influenza and pneumonia rates actually decreased because of the preventive work for COVID, that hopefully we'll get an answer on. But I just want to say I truly appreciate what staff has done without getting our fair share of the CARES Act COVID relief funds.
Our county staff has absolutely done a phenomenal job with the amount of resources that we've received. Maybe next time we can talk a little bit about the financials. We have now are eligible to put in our reimbursement request for a third tranche of money. I believe we've gotten about $7.5 million in reimbursement so far. We have I think, a total of 16 million, I believe, through the end of December, a fraction, ridiculous fraction, comparatively speaking, to our metro areas. I also just want to appreciate in the report the alert levels. I think that's going to be extremely helpful for the community to be able to see those and understand exactly where we're at each level, depending on what happens in our community with our COVID response and sporadic cases specifically. We are running up against our time certain, so I would like to move on to our consent calendar quickly. Is there a motion to approve?
Move to approve.
Is there a second? Commissioner Sorensen.
Second.
Oh, okay. I heard Commissioner Bozovich first. So, motion made by Commissioner Bersney, second by Commissioner Bozovich. Any discussion? Seeing none, I'll call for the vote. All those in favor, please say aye.
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 All those opposed say nay. Motion passes unanimously. We'll move on to item 7A. This is our 10-15 times certain, a discussion regarding racial and ethnic disparities in the Lane County juvenile justice system, a critical race theory perspective, and which with us is Karen Gaffney, our director of H&HS again, and we'll have you introduce your speakers with us. Thank you.
Thank you, Chair Buck and Commissioners. Yes, lest you think we're only doing COVID in Health and Human Services, it is truly a pleasure to be able to have this next conversation with you. I want to start by introducing, we haven't had a chance to introduce the board to Star Felty yet, who is our new manager, division manager for youth services. She came to us in March, right as we headed into COVID. And so she's been hanging out over at Servu, and it's a pleasure to be able to have her here with us today for this conversation with the board, and available to answer questions. And then also Kevin Altucker, many of you know Dr. Altucker from his work in community and at the University of Oregon. He's been working off and on with youth services now for, I think yesterday you said 20 years, off and on. So has a deep relationship, understanding, and appreciation for our juvenile justice work. So mostly I'm going to leave the time for Kevin's presentation, but I did want to at least briefly set up this agenda item because I think it's so amazingly timely that we're having this conversation right now. However, I want the board to know that we've been in this conversation for a very long time at Youth Services. And I know in your packet you have Kevin's full report on racial and ethnic disparities, and he's going to walk through the findings for you on that. And tonight you have the second in the county's series of racial equity listening sessions. So it couldn't be a better time to take a close look at our juvenile justice system than right now, as our community is paying attention to not only racism in the way that we have before, but much more ready to look at our structural underpinnings of racism in our community. And from my perspective, it's important today because we're talking about what those impacts are on our children and our kids moving through our community. So with that, I will turn over the screen and the microphone to Kevin to walk through the report, and then all three of us are happy to answer questions and engage in discussion after he goes through his report. Kevin.
Yeah, thank you, Karen. Thank you, Star. Thank you, commissioners, for this opportunity. Let's see if I'm smart enough to share my screen here. There we go. Well, I'm sharing the screen, but I want to be able to play my slideshow. Okay. Diana, help me.
I can't, because you are in control of the screen. Can you, I don't know what application you're using.
It's a Keynote.
So however you would normally start that, you should just do that and your screen will go.
I think I have figured it out.
Looks good,
Okay.
There you go.
My intent here is to step very quickly through the report that I completed for Lane County Youth Services at almost breakneck speed, and I want to leave time for questions and comments afterwards. So this first slide shows what the report cover looks like. I encourage you, if you have a few moments, to page through the report. It contains much more detail than I'm going to be talking about in this brief presentation this morning. The first thing that I wanted to cover is, well, what is this project and why should we care? This project started about a year ago in November, and then Youth Services Manager Nathalie Frenner asked me if I could evaluate racial and ethnic disparities in Lane County's juvenile justice system. And I said, absolutely yes. I want you to know that I was a county employee during this time. So I worked at a quarter time on this project, and it took about 520 hours to complete. So this is important just to set the context of, my perspective. I was actually an inside evaluator as opposed to an outside evaluator. The perspective that I used for this report was a critical race theory perspective. And this was a foundational component to the report that I found during the literature review process. And critical race theory, which I'll give you a brief summary here shortly, really provided a lot of answers to the reasons why the core causes of racial and ethnic disparities in the juvenile justice system. And as far as I can tell, this particular perspective, critical race theory, has never been applied to issues in juvenile justice. So I think that's important. What's in the report? There's a literature review. I wanted to tie the work into the scientific and academic literature so that we have a tie into what is known about this topic of racial and ethnic disparities. I point out that we as a society have known about these disparities for more than 40 years, and yet we still haven't made significant progress. And I put forth in this report, we haven't made progress because we've been looking at the wrong issues. We've been asking the wrong questions. The racial and ethnic disparities is a common problem across the US, in our state, and in our county. Fortunately, Lane County has made some progress in addressing racial and ethnic, so there is some good news in the report. I interviewed 22 people, mostly folks that work for youth services, but also I interviewed law enforcement, I interviewed school district officials and mental health professionals, I interviewed judges, I interviewed district attorneys, and they provided really a rich narrative of their perspectives about the issue of racial and ethnic disparities in our juvenile justice system. The major findings are, yes, these disparities do exist. We've known about them for 40 years. And generally, African American and Native American youth are overrepresented, mostly in the early parts of the system. I'll show you a slide about that later on. Juvenile justice professionals within Lane County describe this constant balance and this kind of conflict of doing what's best for youth and families, and at the same time paying attention to racial and ethnic disparities. So there was this constant kind of art of doing juvenile justice. And finally, the major finding and recommendations have to do with the fact that Lane County Youth Services cannot effectively reduce racial and ethnic disparities in the juvenile justice system alone. This takes a collaborative systems-wide approach because, as you'll see, what happens to a youth before they get to youth services has more to do with their trajectory and how they traverse that juvenile justice system more than anything else. And so I'm going to be talking about the issues of trauma and early childhood trauma in particular, which is really a driving factor. Critical race theory is this beautiful fabric of many different kind of theories. I've picked 6 that are kind of the most commonly recognized. I'll go through them very quickly here. One of them is that racism is ordinary and normal. This is the normal experience of people of color. Daily experiences are kind of laced with this racism, particularly structural racism. Number 2 is the fact that race is socially constructed. Racial categories are basically made up. And guess what? The white folks made these categories up more than 200 years ago in an effort to kind of establish this human pecking order. And we have perpetuated that lie for more than 200 years. Now, saying that race is socially constructed, I want you to understand that the effects of racial categories are extremely real and mostly detrimental for folks of color and generally beneficial for white folks. So the effects are real, but the categories are socially constructed. It's a social construct. Number 3 is this idea of interest convergence put forth by Derek Bell, who actually was a U of O dean of the U of O Law School back in the early 70s. And he says that that laws passed and legislation passed to reduce racial and ethnic disparities only pass and they're only approved if they benefit the dominant society, which is in our country, the white society. Number 3 is this idea of intersectionality and anti-essentialism, which are both about $15 words, which just describes that all human beings have this incredibly complex and beautiful network of identities, right? So if you just think about your own selves, each of us has this really beautiful, fabric that is our story. I included a little bit of my story in the report just as a way to, as an example, that it's just not correct to put people in certain categories because we all kind of have these intersecting interests. We can't be categorized, we can't be pigeonholed. That's basically what intersectionality and anti-essentialism means. Critique of color blindness just means, listen, if we make decisions and we don't recognize a person's race or skin color, not only is that disrespectful, but it doesn't recognize the centuries of discrimination and oppression often that folks of color have experienced. So critical race theory is very, very critical of color blindness. And finally, critical race theory puts forth that people of color are in this unique position to offer their stories. And these are often called counter stories because they counter the dominant culture, the white culture's stories. And often those stories from folks of color get drowned out, they get pushed aside from the dominant culture story. The dominant culture story gets told often, so often that people then begin to accept that as a truth. And so really, this report recognizes the importance of those counter stories, making space for those counter stories to be heard and listened to and acted upon. I did a literature review. There are gaps in the existing literature so wide that you can drive a truck through. And I just want to touch just really briefly on this, that the gap that I identified is that social science researchers and juvenile justice professionals have done a poor job in the last 40 years of recognizing the effects of trauma on childhood development, right? And so this report highlights the fact that we really need to recognize that trauma, specifically early childhood trauma, has no expiration date, and it detrimentally affects the development of young people. And so the report says that on average, youth of color experience trauma levels higher than their white counterparts. Part of that trauma comes from the discrimination and the oppression that stems from structural racism. So that's really the huge gap, and what I believe that social scientists and juvenile justice professionals have missed in the last 40 years. They've also made the mistake by treating race as this magically discrete variable that is somehow magically associated with personal characteristics. That is a fundamental flaw in the social science research. Yeah. Next slide is. This next slide is an attempt to show the historical trends over the last 10 years in Lane County. The bar chart represents the number of youth that had referrals to Lane County Juvenile Justice. And referrals typically come from law enforcement. So you can see on the,
I'm sorry, are we seeing the right slide right now?
Well, that is a good question. And I'm wondering why it is paused. Well, I am stumped right now, folks.
Kevin, if you would like to email me the presentation, I can switch to presenter and I can try showing it for you, and you can advance with just telling me to do a new slide.
Sure. I think at this point, Diana, that if I'm going to try and stop sharing my screen and I can just go through, I just have one or two more slides, but I do want to tell you the recommendations, and I can just do that verbally. And I apologize for the technical glitch here. I have no idea why this is paused, and I am having trouble not sharing my screen.
Just for your information, we've only seen the first slide with the name and name of what you're presenting.
Well, that is unfortunate. Okay. Are you seeing this screen right now?
No.
It shows a bar chart.
I took control back of the screen, Kevin.
Okay.
So, and
Great.
Kevin, I think that I have a copy of your slides, and I'm happy while you're talking to send those over to Diana and see if she can at least get them up so that we can see the recommendations. Would that be helpful?
Sure. Why don't you try that? And I will pick up where I left off as that takes place. The show must go on, right? Virtual platforms are great, but sometimes we'll have a few technical difficulties.
We appreciate you hanging in there with us.
You know, well, I'll try to stay on task here. The slide that I was speaking to was showing a general downward trend of the number of youth that are referred to Lane County Youth Services every year. And in the last 10 years, you'll be happy to know that there's been a 56% decrease in the number of youth that have been referred. This reflects statewide trends. This reflects nationwide trends. So the level of youth crime is at historically low levels. That's really great news. Now, most of the youth who are referred to Lane County are white. All right, but the vast majority of youth that are referred to Lane County are white. The problem is that African American youth and Native American youth, for the most part, are overrepresented, not only in referrals, but in other parts of the system. And Diana, you are working magic.
I now have your slides if you tell me where to go.
Yeah, why don't you go to the slide number 5, which is the bar chart. Great. So this is the bar chart I was just describing, and I won't spend much time on it, but I want you to see visually there's been this dramatic decrease in the number of youth with referrals. That's really great. And I took an average over the last 10 years, and you can see on the right-hand side, of course, the average number of white youth is 788 compared to the average number of African-American youth at 60, average number of Hispanic youth at 89. So next slide, please, Diana. This is a very wonky slide, and I made it because I want to introduce to you this idea, what's called RRI. This is called the Relative Rate Index, and this is a way to compare youth of color with white, all right? So if a youth of color is overrepresented they're in a certain category, their RRIs, their relative rate index, are typically going to be above 1, right? So they're overrepresented compared to white. So just really briefly, if you look on the right-hand side of this slide, there are 3 columns: African American, Native American, and Hispanic. And you may be wondering, well, what about Asian youth? Asian youth were underrepresented compared to white youth in all categories. I didn't include them on this slide. But if you look at African American youth, and there's that 2.63 on that first kind of box under the column there, that 2.63 corresponds to the referral process. That means that African American youth in 2019 were overrepresented 2.63 times compared to white youth who had referrals. So that is an issue. That is an example of racial and ethnic disparities. The good thing about this particular slide is it shows that the deeper that youth get into the system, and if you go down that middle kind of flow chart, starting with referrals and ending down there towards waiver to adult court, you can see that the numbers on the right-hand side start to disappear. And that's the reason. The reason is because the number of youth of color, they're so few, the deeper that you go in the system, that we're unable to calculate any RRIs. Next slide, please. Just really briefly, I interviewed 22 people. Their comments kind of broke into 2 big categories: what happens to youth before they get involved with the juvenile justice system, and what happens after. And just I want to highlight the fact that most juvenile justice professionals in Lane County had a very keen and accurate and perceptive idea about what critical race theory is, the effects of trauma on youth coming into the system, and they were very, very aware of it. And they also described this balancing act as I described earlier. What is best for youth and families, and how do we reduce racial and ethnic disparities? And you may be wondering, well, why is there a conflict? Sadly, oftentimes the only way that youth can access services is if they get more deeply involved in the system. And so there's that constant kind of balance. I will say that there were a very few number of comments from folks outside of youth services that had the perception that to hold youth accountable, we should penalize them more. This is the idea of being tough on crime, and that was a very small number of comments. Next slide, please. Recommendations, there are 9. I won't go through each of them word by word here, but basically the recommendations are yes, racial and ethnic disparities exist in Lane County's system. Lane County alone cannot effectively reduce red in their system, because what happens before a young person gets involved with them has more to do with how they're treated in the system than anything else. There were some problems with the state supplied numbers, the quantitative numbers. One of the recommendations is fix it. That's up to the state. This is going to be a tough conversation moving forward. And the first thing that needs to happen is to recognize the fact that structural racism does exist in our state, in our county. And that's kind of the first thing that we have to have a conversation about. We need to make room for those counter stories to be heard, to be listened, to be acted upon. And there's a very specific recommendation about a task force should be convened to look at policies within youth services and how structural racism might be affecting those. And also a recommendation to look at the positive youth justice document put forth by the Annie E. Casey Foundation and the National Institute for Criminal Justice. That is my quick presentation, and I am happy to answer questions or entertain comments.
Thank you very much. Any questions from commissioners? And if Commissioner Farr is on the phone still, just shout out if you have any questions. Commissioner Sorensen.
Thank you very much. Well, first of all, Dr. Tucker, thank you so much for your presentation, and thank you for referencing Derek Bell. He was one of my professors at the U of O Law School, and we were very fortunate to get him from Harvard when he came here. I'm interested in the term critical race theory, and you know, there's different types of theories. One might be the theory of relativity, and one might be, you know, Pete's theory of the stock market. The theory of relativity is an established norm in our society, where the latter is just something I made up 2 seconds ago. Can you tell us where the term critical race theory, how much of an established view it is? Because I think, you know, in my view, at least, it seems like a very logical idea that race is a construct that, you know, someone has made up. You said white people made it up, but it's been made up, and it tends to harm people, and is being used by the dominant culture to harm those that are in different races. So I'm just curious, you know, because you know a lot more about this than we do, if you could give your view on the vitality of the term critical race theory.
Yeah, great question. Critical race theory is an extremely well-developed, and it's a literature that started in the late 70s, mid-70s probably, and it came out of a desire to address the fact that many of the civil rights advances of the mid-1960s, for example, Civil Rights Act or the Voting Rights Act, the progress had kind of stalled, and so scholars were wondering why, and that was the beginning of critical race theory. So it is well developed. It is it's a large literature, and it is dynamic, and it's changing every year. Derek Bell was one of the foundational authors of critical race theory, and others as well, but his voice continues to ring true.
Thank you.
Mr. Bozovich.
Thank you. And I appreciate the report's acknowledgement of the pre-existing conditions for youth that end up involved in our justice system. I hope you can't hear that noise in the background. But okay, good. I just want to say that critical race theory is not entirely widely accepted. There is a large body of critiques of the theory and its dependence on storytelling versus objective data. And I'll just say that I would not sell Ron Wilson and Coy Thomas, who were in my wedding, or my first roommate in college, Bobby Frierson, to aliens for gold. So, yeah, and anyone that knows Space Traders and Derek Bell's, short story will understand that reference. So there is a substantial body of critique about the theory. And I think one of the things it doesn't recognize at all is the involvement of the federal government's war on poverty and what it did to destroy the nuclear family in the Black community in a lot of ways, and the impact that's had in creating trauma in early childhood that hasn't necessarily been recognized in the theory. I do appreciate that you recognize the good work that our staff has done. We've been looking at disproportionate contact with youth of color in our system for a long time. It was a buzzword when I became a commissioner in 2011 and got sworn in, and there was a lot of work already being done on that basis and trying to correct some of those numbers in your RRI. And the problem is there's one number we don't have control over, which is the initial contact with the criminal justice system, either through law enforcement or some other referral, which that has more to do with there is trauma created in those families, and it has some racist basis to it, and I don't disagree with that analysis that a lot of that trauma comes from there. I'm just not ready to completely accept every tenet of critical race theory. So I appreciate the report, and the recommendations make some degree of sense, although I'm not so appreciative of maybe making this our basis of our whole system based on a theory that's based on storytelling versus objective data. One of the things about theory of relativity is it's based on some objective observations of physics.
Thank you. And of course, any theory should be subjected to robust criticism and examination. And perhaps at another time, Commissioner, I'd love to engage in a conversation with you about the idea of the power of these counter stories and the fact that they are valid data, and the issues of kind of looking at quantitative versus qualitative and how those apply to the juvenile justice system. But I appreciate the skeptical eye. I think that's healthy as we move forward.
Mr. Burney.
When you two have that discussion, I don't want to be there. Just kidding. Chair, can you hear me okay?
Yes.
Okay. Kevin, when you were, first off, is this the Kevin Altucker that maybe 28 years ago I served with on the Relief Nursery Board?
One and the same, Commissioner, yes.
Good to see you, old man.
Nice to see you.
I appreciate where you're coming from, and everything I say has to be in that context. And my only joking comment I'd like to make is when you said that the holes in social science theory as it related to this subject were big enough to drive a truck through, I was wondering if they were big enough to drive a Eugene sand and gravel truck through.
Absolutely, yes, a couple.
And maybe others don't understand the reference, but I know you do. Okay. My opinion is that there is all of this theory And I'm someone that left academia and thinks that theories are professors' attempts to describe reality in such a way that they can sign their name on it. And so with that view, I think all of these theories are getting at the fact that obviously we have institutional mechanisms of inclusion that support an economy that cannot fully and equally employ all people. And when we look at that, for me, when I look at that as a context, I, for one, believe that we have known about these disparities for well over 40 years. Only yesterday, I spoke to a dear friend of mine who, at the age of 12, his family moved literally from the cotton fields of Mississippi to Portland, Oregon. And many of his years, he grew up in Vanport. He's 89 years old. They knew about these disparities well before 40 years ago. I also, and I hope you respect this, Kevin, because it's not personal. I know you know this, but look at what we have here. We have a white guy talking to white people about the problems with white dominance in this particular system. Maybe I'm the only one that seems a little odd to, but I just wanted to point that out. And I hate the fact that you said that this report was developed at breakneck speed, because this is the pervasive issue. This is the issue that you are shining a light on. But even when one shines a light on it, in my opinion, if you don't have the context, you might be looking at the wrong part of the beast. There are descriptors. I believe that my opinion is that when we talk about equality of jobs and job opportunities, good housing, good schools across the board, you would see a lot of these data points that you're sharing with us change. And it would change because the overarching society changed. We, as you say, this is not just a Lane County problem. So I just wanted to make that point. And really, I appreciate where your heart is. I appreciate where you've chosen to put your life's work, given what I know of your family. And it's wonderful. And yet I do want to approach this in a different type of skeptical way than what Commissioner Bozovich did. But that's my way. That's what I'm looking at. And I thank you very much.
Thank you, Commissioner. Well, I'll look forward to future conversations with you as well.
Not a problem. I'll go as granular as you want.
Look forward to it.
All right, thank you very much for the report. There's a lot put into it, and I think it's about time we talk about these things. As Commissioner Burney said, we've known about them, but it's only now, it seems, that this kind of open dialogue and discussion about the reality of what's going on is actually done in public, where it's okay to talk about these things now, and nobody has to feel like they have to hold back in case they offend somebody. These are our new realities for people like myself who are white. And that's a good thing. We should be talking about this more. I fully appreciate all the recommendations that you've put forward and support them very much. There's a lot of work to be done. We do need to bring folks of color up to the table and give them a place to speak. I'm a white woman of privilege, and we're talking about racial equity here. It doesn't make sense not to have their own words and their own stories presented in a way where we are not going to be judgmental and internalize that, know their truth, and make change. And this is an important piece of that. So thank you very much. And I know all of you were a part of this. And, structural racism is there. We all know it now. If you haven't experienced it in your life because you weren't one that was being affected, most likely because you're white. We have to do something different. We can't continue the way that it is when this is presented. So I don't know what you need from us to move forward in this, Karen.
Thank you very much, Chair Buck and commissioners. I would like to talk just a little bit about next steps. I know we have limited time this morning, but I think it's important. It was important to us to be able to share this information with you as the board, because I think it's important for leaders in the organization to be informed with what we're discovering as we move through this work. And also because as a board, you recently have passed your own resolution around how we engage with community in terms of addressing structural racism. I think the timing is excellent, as I mentioned when we started. For the public who's watching, I wanted to remind people that the county is hosting a listening session, not only tonight, which is kind of a general session, but also one that's specifically around issues of juvenile justice. And that's on Tuesday, September 1st. And people can sign up for that on Lane County's website. And the format is one that really is designed to create space for hearing those stories. And so we encourage people. I know the virtual environment is not all of what we would want to be able to create that space, but it's what we have right now. And we can't wait for COVID to be over to address these issues on a much deeper basis. So one piece is I would encourage the public to join us for that event. And also, I think it's important to acknowledge that it's not an either or when we talk about stories versus data. What I believe has been true is that our focus has been exclusively on data, and it doesn't have the context that it needs, and it comes out of our racist systems. So if we don't also have space for that counter narrative, then we don't have all the information that we as community and as leaders in community need in order to effectively address racism in our community. And I think about, as we talk about recommendations on task forces, I guess I would also say to the board that this is an issue that goes beyond how we typically think of our juvenile justice system. As you read through the details of Kevin's report, you'll see again that the issue really is that kids of color come into our system. I think his phrase was hot and fast. So really looking at what is the experience in our community here in Lane County that induces trauma for these young people. So for us to address red in the juvenile justice system, we have to partner with our education system, with our child welfare system, and look at the general structures in our community as well. So I would hate for people to think that as we move forward with the task force, that it's going to be a particularly narrow piece, but it will be both looking at our policies in our juvenile justice system, but also looking at our connections out into community, staying focused on how do we improve those systems so that our kids can thrive, so that all of our kids can thrive in the community. So I just wanted to set that tone for what you as the board and what the community can expect to see as we take up these recommendations and move forward.
Commissioner Burney.
A couple of questions. One, are we being asked to approve a task force, or is that happening anyway?
We are not asking you to approve that at this point. There's a number of audiences as we move forward with the recommendation of sharing this report widely. We had an opportunity for Kevin to present the report to our staff yesterday. And I would expect that we also will take this up in the Public Safety Coordinating Council Juvenile Committee as another place to share the findings and talk about steps moving forward. So there's
Okay.
not action in front of you today.
Okay, so as you're socializing this, which is what I hear, I hope someone is documenting the responses, and so that we can not only benefit from this report, but benefit from how it's received. And I would like that sort of coalesce in some way that this board could look at that. Number one, excuse me. And number two, quantitative data means nothing without being interpreted. Qualitative data is always a part of a complete evaluation or methodology to understand anything. When you talk about people sharing their stories, you are talking about what I learned is culture carrying competence. Oftentimes that means elders sharing stories with younger people, which does not happen enough in our public schools. Now you're also talking about people of whatever age that come from different groups speaking about their stories. So as you say, generally you're coordinating with education. I would like to see a specific plan to integrate these stories into classroom curricula throughout the county. Thank you.
Any final thoughts from anyone? Okay, I don't hear any. Thank you again for the report, and I'm sure we'll hear more in the future.
Thank you very much.
Thank you, Kevin.
We will move on to item 7B on our agenda, which is order 20-08-18-08, in the matter of accepting and improving people's access to community-based treatment, supports, and services program impacts grants from the Oregon Criminal Justice Grant, delegating authority to the county administrator to sign the grant awards and adding 10 FTE positions to fill the grant requirements. And again, Ms. Gaffney.
Thank you, Chair Buck, Commissioners. I don't know if you share this experience, but I feel like we're on a tour of Health and Human Services this morning. So we have now landed at our Behavioral Health Division. And to be perfectly honest with you, this is an item that could have gone on the consent calendar. It's accepting a grant. And it's just such a remarkable thing. I wanted to just take a couple minutes to celebrate with the board the fact that the action you're taking today would be to accept a $2.5 million grant from the Criminal Justice Commission to help us provide early intervention and coordinated services for people at this intersection that we've been focused on as a county of behavioral health concerns, public safety involvement, and homelessness. That's our population that is the focus of this impacts grant. And we've done work leading up to this around our Fuse project, getting our data together, building our community partnerships, and all of that work was recognized by the Community Justice Commission, Criminal Justice Commission, when they selected Lane County as a recipient for this grant to provide us the next piece in our vision for a crisis center in Lane County. So the 10 FTE that will be created as part of this grant will be creating that forensics street intervention team to be able to go out, find people where they are in community, focus deeply on engagement for people, and then coordinate with all of the great work that we've been putting in place on the housing and homelessness side to help people stabilize, engage in treatment, get housed, and avoid jail, the state hospital and prisons, where we know is not where our people with mental illness and addiction belong. So I just wanted to take that moment to celebrate with the board this piece. And so that's what's the item before you today.
Thank you very much. And what will these 10 people be doing?
That is a great question. And for the public, if you click on the material, you'll see the very last page is a list of the specific FTE. We have a couple people who will be working directly with the courts and providing a warm handoff and a presence in the courts to make sure that people who have been cited and find themselves either in muni court or circuit court have assistance right there from the mental health system to help them move through. And then the bulk of the staff will be part of our forensics intervention team, essentially a street engagement team that includes psychiatrists, peer support specialists, as well as mental health specialists, providing a team effort that is kind of similar to what some of us know of as ACT teams, people who assertively go out, engage with members of our community who might be feeling particularly disengaged from the system, largely because of their mental illness and their experience with the system, and work on building trust and engagement, and then finally help move those people into treatment that we know from the literature is then life-changing as they move away from our criminal justice system.
Thank you very much, and congratulations. Wonderful to hear. I know you did a lot of work to try to get this grant.
I move approval.
Second.
Oh boy. I'll say moved by Commissioner Sorensen, second by Commissioner Bozovich. Any discussion, Commissioner Bozovich?
Thank you. I just wanted to speak to this a bit as somebody that lobbied to get this program off the ground a bit with the legislature, as originally designated was the mental health reinvestment grant program versus the justice reinvestment grant program. The intent was to put dollars out to local communities to divert people from being involved in the criminal justice system and then getting what they call a 371 aid and assist referral to the state hospital system, which doesn't usually help them, because the only thing when they get referred to the state hospital system, because they can't aid and assist in their own defense, they get treatment. They a lot of times only get taught, what's a jury, do you understand your charges, those sort of things, not necessarily fix why they were, creating an issue maybe out on the streets of Eugene or Springfield. And we've had a long history here in Lane County of trying to help that intersection of homelessness, mental health, and the criminal justice system, starting with the cahoots model that is being now thought of as a national model, to our co-location of mental health providers with our physical health teams in our federally qualified health clinics, to our location of mental health professionals in our jail, to our 23-hour crisis center, to our Fuse project and MLK Commons project, to our treatment courts, to how we've switched parole and probation over to, understanding cognitive behavioral therapy and trauma-informed care. All throughout our system, we're working towards trying to help people deal with mental health issues and avoid the criminal justice system. And I just want to say this grant is being awarded because of our history of doing so in a lot of ways, and is reflects on, one, our staff and their ability to write a good grant application, but also on our commitment over time to trying to divert people away, even though technically a lot more people from Lane County end up in the state hospital system on aid and assist. Most of those people are coming out of the municipal court systems. And we Lane County don't send those people there, but we can maybe stop the front end with this project. So I really appreciate the work that's being done under this grant.
Commissioner Burney.
Karen, congratulations. You said we were here to celebrate. So I'll lift one up to you. And I want to thank Commissioner Bozovich for the statement he just made. I think it demonstrates to those that like to stay into the political divisiveness arena how wrong that is. And Commissioner, I think that you just spoke to the history and the heart and the intent to keep our people whole and to divert them from lifetimes that go nowhere oftentimes once they get into that system. And I just want to say that for as much as I may disagree with you on the impacts of the war on poverty, I could not agree with you more in terms of the statement that you just made.
Any other comments? I just want to acknowledge the fact that, you know, grants like these and opportunities like these that arise that Lane County takes advantage of keeps us on the cutting edge of how to modify our criminal justice system to meet the needs of our community. And this is, you know, a reflection of doing so. I look forward to seeing how the results of this come back to the board and show how we can really make some meaningful impact in our community. If there's no more discussion, I will call for the vote. And if Commissioner Farr is on the line, if he could let us know if he's available for this particular vote. So all those in favor, please say aye.
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 All those opposed, say nay. I did not hear Commissioner Farr, so I will say the motion passes 4-0 with Farr excused. We'll move on to item 7C, Order 20-08-18-09 in the matter of approving 4 contracts and 14 amendments and delegating authority to the county administrator to sign the approved contracts and amendments. Ms. Gaffney.
Thank you, Chair Buck and Commissioners. This item, as you know, we routinely bring to you contracts and amendments for approval. And in this particular packet, there are a number of contracts, so I'm not individually going to go through them. However, I'm happy to answer any questions that anyone might have. I might lift up for you in particular under the new contracts. We do have Homes for Good and our healthcare funding for the Commons on MLK as one of the new contracts here. And if you have not been out on MLK Boulevard lately, I know many of us are staying very close to home, but the building is really looking terrific out there, and our staff are busily working with our community partners to prepare for a January occupancy of that building, which is very exciting. And you'll also see a number of other contracts and amendments. Some of the amendments are related to additional COVID money that has come into the community that we are then moving out to our subcontractors, and as well as additional more routine contracts.
Any questions? I have one. I noticed there's additional funding for the community sharing program down in Cottage Grove. They have not had the funding they've needed and have been advocating for more. Is this increase their allocation, comparatively speaking, to last year?
That is a great question, Commissioner Buck. And I do not know, and I'm so sorry, I don't have that level of detail. The amendment amount for that particular contract is $768,220. And I don't know if that increases their allocation over the current level. It is a new RFP process, it looks like, that has gone through for that. And I certainly can follow up and get you an answer to that question.
Appreciate that. Any other comments or questions on this item? Okay, I don't see any. So is there a motion to approve?
I'll move approval.
Second.
Moved by Commissioner Sorensen, second by Commissioner Burney. Is there any discussion? Seeing none, I'll call for the vote. All those in favor, please say aye.
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 All those opposed, say nay. Motion passes 4-0 with Commissioner Farr excused. So we'll move on to our last H&HS item 7D on our agenda, Order 20-08-18-10, in the matter of approving participation in the Oregon Primary Care Association Community Health Center Network of Oregon. Ms. Gaffney and Mr. Helm.
Yes, thank you, Chair Buck and Commissioners. This is our final stop in Health and Human Services this morning, is at our community health centers, which I know we have not had an item in front of you for a while about the CHC. It really is that remarkable footprint that we have in the community to provide critical primary care in the community. And so it's my pleasure today. I have Ron Jelm here, our division manager for the CHC. And the item we bring before you today is a unique opportunity for us to look differently at how we do some of our contracting for insurance participation in terms of our community health center, and really mirrors some of the work that's happened in the private sector for a long time. So I'm going to turn it to you, Ron, to explain this particular item and the action that we're requesting.
Thank you, Karen. Thank you, Chair Buck and Commissioners, for the opportunity to chat with you for a few minutes this morning about this opportunity to participate in the Community Health Center Network of Oregon at the Oregon Primary Care Association. Lots of Oregons there, lots of networks. I'll just refer to this as the network for brevity. And before as my light goes off, I'll wave. There we go. Before I review actually what the network is, let me give you a little context of the why. What challenge are we looking to address? What opportunity are we looking to address? I've spoken to you a number of times over the last couple of years about the movement of payers from paying traditional fee-for-service into value-based pay. That is, having a component of what we receive in payment as a reflection of the clinical work that we have done. And that trend in payment is not only accelerating, but it is increasing in the complexity. The acceleration is that as an example, the Oregon Health Authority is requiring that CCOs will have 70% of their payments in value-based pay by 2024. That's an astronomical change from roughly 20% today. So not only is it an increase in the dollar amount, but it's an increase in the complexity of the services that are being compensated. So we have a number of different opportunities here we're trying to address in moving into this network. One is, quite frankly, an asymmetrical stance of both knowledge and expertise. As we go into higher level of payments and increasing level of complexity of payments with these insurance carriers, quite frankly, we're at a unique disadvantage across the negotiating table, and we have great relationships with Pacific Source and Trillium. This is nothing about the organizations across the table. It's about the complexity of the negotiations. They have, in some cases, they're regional, if not national organizations. They have whole buildings full of actuaries and financial analysis and so forth to understand the intricacies of insurance contracting. We're at a disadvantage in the contracting. Quite frankly, we're at a disadvantage in the management of the contracts that we might negotiate because of the complexities on the operational side of kind of understanding all of those components that we might negotiate. We're also at a disadvantage in terms of our leverage. We are a major player in the Medicaid market. We have roughly 20% of the Medicaid population here, but we're in one county. We're with, a single source negotiation, if you will, as we sit across the table. And uniquely, as a federally qualified health center, patients or providers very often say our patients are sicker. Well, we really do believe that our patients are sicker because we know we have a disproportionate share of homeless patients. We know we have a disproportionate share of patients who have social dynamics, social determinant challenges. And as a result, what that means is an example, for instance, we routinely see that the patients assigned to the community health center have more emergency room visits in the community than our peers. They have more expenses in other areas. Unless we have a mechanism to risk adjust some of the risk that we're taking for that patient population, we're at a significant disadvantage. The opportunity, quite frankly, is that because we have those individuals and because this community health center, we should be uniquely qualified to take care of those individuals with the patient care coordinators and the other staff who we have. If we do the contracting right, I am confident we will do a good job, not only clinically, but financially in the types of contracts. So those are the challenges and the opportunities. The biggest challenge for moving into a network that the community health center and my peers around the state and quite frankly, in other areas of the country have identified is if we come together in a network to sit down at the table with these payers, we can drive a better contracting, we can have better understanding of the financial complexities, we can have better outcomes in terms of driving internal as well as contracting processes. The problem is with my Norwegian complexion, I don't look good in an orange jumpsuit. And I can't sit down with my peers and talk about contracting terms or contracting strategy unless we have a legal vehicle that enables us to do that. And so the network is a legal vehicle of bringing together our peers, the community health centers across Oregon, together to share contracting strategies, to do joint contract negotiations, primarily with the coordinated care organizations initially, and then other payers, to drive that performance. So the Oregon Primary Care Association identified in its strategic plan that this was an important endeavor. We have done a tremendous amount of work over the last year and a half, 2 years, in looking at how to put this together, looking at our peers in other states, Ohio, Montana, Michigan, Colorado, in types of these entities. The network is organized as an LLC. Participating organizations will all be a member of the network and all have a vote at the board in driving the contracts and deciding what type of contracting strategies we will have. The county council, Andy Clark and Sarah Chinsky, have been very helpful in reviewing the participation agreement. OPCA has reached out to counties, Multnomah, Clackamas, other county CHC organizations to help identify what are those unique components of the county structure. And so the participation agreement has been modified, most notably to ensure that any contracts that are negotiated are brought back to the Board of Commission for approval. That was a component that's unique that we didn't see in other states. And because we have county-sponsored CHCs here in Oregon, that component is a component of the participation agreement. So anything that's negotiated on our behalf, first of all, we can decide ahead of time if we're going to participate in that negotiation. And then if there's an agreement, it will come back to the county commissioners for ratification and approval. We will not be bound by that. So I can answer any questions. Those are the key components of why we are recommending moving into this direction, and some of the benefits we see in participating with our peers in this type of strategy.
Any questions from the board? Commissioner Bernie.
Forgive my naivete here. It just sounds like what you described is good management that groups that are parts of associations do anyway. And I'm just curious, who is the Oregon Primary Care Association Community Health Center Network? How long has it existed, and why do we have to pay $30,000 for you to talk to your peers and figure this stuff out?
Good question. So this is a new entity. The Oregon Primary Care Association has been in place for many years. This is a new entity. Antitrust law does not allow individuals to get together for purposes of sharing contracting strategies, contracting terms, and negotiation, absent a organizational vehicle that would allow them to do that. The Oregon Primary Care Association is not that legal vehicle. We can't do that through that mechanism. So the network is organized for the specific purpose of clinical improvement and operational improvement and joint contracting. And it is a specific legal vehicle that allows us to, quite frankly, be in a room together and share those conversations and to have that joint negotiation.
Yeah, I'm sorry. You're telling me that antitrust laws that were designed for private business stop public entities from talking with each other on this subject?
That's correct.
And how many members will be paying $30,000 a pop?
The membership varies by the size of the organization. Of the 33 members, currently 14 of the 33, not counting Lane County, have indicated they are going to participate, and that number is been increasing as folks are having these conversations.
Thank you. Obviously the intent is 1,000%. We have to do that. I can't, it's hard. I believe you, but it's counterintuitive to think antitrust laws are stopping public entities from communicating with one another.
And I would say, Commissioner, not all of the entities are public entities, and so many of the participants, in fact, the majority in the Oregon Primary Care Association, are not public entities.
But we are.
We are, but I couldn't, for instance, have a conversation with Virginia Garcia, which is a nonprofit private entity, about its contracting terms.
I'm going to end this. I don't want to take much time, but I would argue, yes, you can. It's she that can't have the conversation with you.
Okay.
Any other questions? Seeing none, we'll go to a vote. So is there a motion to approve the order?
So moved.
Second.
Okay, moved by Commissioner Bozevich, second by Commissioner Burney. Is there any further discussion? Okay, hearing none, we'll go to the vote. All those in favor, please say aye.
Aye.
All those opposed say nay. Okay, motion passes unanimously 4-0 with Commissioner Farr excused.
Thank you, Commissioner.
Okay. Yes, thank you. So we'll move on to County Council. Are there any announcements?
No announcements, Chair Buck.
Okay. So you have one more item for us, a discussion regarding redistricting work session.
Yes, Chair Buck, thank you. Chair Buck and members of the Board of Commissioners, you should have in the materials that I've provided basically the roadmap. And what I'm looking for today, I'll be very brief in my presentation, is a little more detail on how you want the process to work. You saw that I compiled a list of people that were to be invited. You saw how long that list was. When the invite goes out, the formal invitation, we need to be specific about what we're asking people to do, because I know I'm going to get inundated with questions if I just say you've been invited to this work session. Because I think you need to decide, number one, do you want people to submit written materials? I think that you can, and you can have them submit them even if they don't appear. Really, the critical thing that I'm looking for direction on is how the work session is going to proceed with those individuals that do decide to appear, albeit virtually, and participate. In other words, does everybody get 5 minutes? Does everyone get 3 minutes? Do you bring them up in panels? Because I know those are questions that I'm gonna get. So really, that's my my presentation. I'm just really looking for very specific direction from the board as to how you want this work session to proceed.
Any thoughts? Commissioner Sorensen?
Thank you. I think the easiest thing to do and to give Mr. Dingle direction, at least in my view, we should ask people to submit written materials, and we should have a forum at which each person that's been invited, if they wish, to present their views. And I'll leave it up to the chair at the time of the meeting to figure out how much time to allocate. But I get the feeling that, you know, that maybe 5 minutes per person who actually shows up to the forum will be sufficient. But I think that that's the easiest way of doing it, and that way people can give their views and the board can take that in. If only 2 people show up, maybe they can have 10 minutes each. But I think if 100 people show up, then maybe only 2 minutes each. So that's my idea. So,
Mr. Bernie?
Forgive me, but I feel this is the second or third time we're having this discussion. It would seem at this point, Steve, if you were tasked with it, and I know I sent you my input late, and I admit it and I apologize for it, but it seems like if you would develop, based on all the discussions we've had, your best shot at what that should look like, how it should be structured, what the question should be, the amount of time allotted, et cetera, and let us respond to it. So we're not shooting in the dark and we don't continue the conversation. It's my thought.
I'll add that I'm interested in seeing written material prior to having a forum of the invitees. Kind of want to get an idea of how many people respond, so we do know how much time to allocate for them. And when sending out the material, part of this, I know we discussed this last time regarding asking specific questions. I think Commissioner Bozovich brought this up for, regarding, do we want elected officials to make final decisions on our boundaries? I do agree that those are leading questions, but I also think it's kind of a given. I mean, I don't think we would be talking about this issue if many of us didn't already feel that way. If we are submitting questions that are going out with this, like a questionnaire, I think that needs to be vetted. But I don't know that a questionnaire necessarily is needed. I think just an invitation to respond would make a lot of sense. And then be able to see what responses come back, compile them, present them to the board, and then us discuss where we want to go in the next step. But those are my thoughts to this point, at least. Anybody else have thoughts? Commissioner Bozovich?
So, maybe so we're not quite so leading with those questions. Maybe we could ask these individuals and organizations, do you have any concerns with the current process for setting boundaries for commissioners' districts? If so, what are they? And then what would you propose the system be if you were to ask for, to change it? And that way it's not really a leading question so much. Do you have concerns? What are those concerns? What changes would you propose? And ask for maybe those to be submitted back to us in writing by some date certain, so you have an idea of what, where they can kind of get compiled, and also an idea how many people want to actively participate in the discussion.
Commissioner Bernie?
I think that's a great idea. And I think it would be preceded by what the intent of this is, which is to have the fairest, most engagement, most people control over over what those districts are. But I'm going to reiterate. First of all, Steve, the email that I sent you too late, is it okay if I forward that to other board members so they can see what the input on process was? I'm asking you if that's okay, because I don't know.
Yeah, that's fine, Commissioner Birdie, as long as they don't respond.
Okay.
As a group.
Okay, so you will get that from me, and I will put on the subject hit, do not respond in capital letters. But it
Not reply.
I'm sorry?
Do not reply all.
Thank you, sir. Will do. And so I won't belabor what's in there, but that attempted to articulate a process that included getting input, very short, concise, and structured via email from anyone and everyone who wants to provide input, having a public input session, and then weaning that down and selecting the right kind of people on the basis of that to actually participate in the work session and yet have all that data for us to look at. But I like Jay's thoughts in terms of kind of moving it forward without any leading questions.
Any other input? I agree that the change in the overall intro question makes sense. As part of the letter that goes out. It's just a reminder that we do have a public comment session set up for September 15th for the public to talk to us about redistricting specifically. It could be also a good date for written comment to be returned. That's basically 4 weeks from now. Well, how do people feel about that? Got a thumbs up from Commissioner Murray. Thumbs up, Commissioner Bozovich. Commissioner Sorensen, any input?
Yes, I think that if we're going to have multiple sessions on this, that one of the things that we might want to do is uncomplicate it and just say we're asking for written comments and we're asking for participation at the September public comment and leave it at that. It seems like if we overly complicate it, then we'll greatly restrict the number of people who are willing to participate.
So I'm confused about the complication factor. I think what we're doing is inviting written comment and having a public forum on the 15th. Was there something about that? You just wanted everybody to reply by the 15th in a public comment forum. I personally would like something written, because if there's something different from what's been proposed by the League of Women Voters, I won't be able to take notes the entire time to be able to document that. It makes sense to me to have some written response.
Why don't we do this, and why don't we ask people, why don't we have Mr. Dingle say that the board has done two things. One, we've asked Mr. Dingle to request written comment from all these people, and written comment on the ideas the public has regarding the redistricting responsibilities that we have under the current Lane County Charter and any proposed changes to that charter, and ask for that written comment to be received by the September, I believe it was 15 deadline, and then invite, secondly, that the board decided to hold a forum for those people who wish to participate and send in and be present virtually at that forum and present whatever ideas they have that otherwise have not been presented, or elaborate on what they have written. And that way we've done two things today, and we've gotten the written commentary that you're interested in, and we've gotten the testimony that I'm interested in.
Okay. I guess the confusion might have been that is what I thought I mentioned. So I don't think there's any pushback on that. Sounds like that makes sense to what everybody has been saying. Mr. Dingle, is that clear enough for you? Do you need more information from us?
I don't think so, but can I summarize what I understand?
Yes, please.
what the request is? I will take that list of organizations and individuals that I sent to the board. I will send all of them an email. The cover email will say that the board is soliciting written input from each one of you. And your written input should focus on those three questions neutrally phrased as Commissioner Bozovich proposed, and any other questions that I get. And if I could get those by close of business this Friday, and if those written submissions could be sent, and I'll figure it out. I think what I'll do, I'm trying to figure out logistically whether it's easier to have them sent directly to Ms. Jones or to me and forward. I just want to make sure that everybody gets the same information at the same time. I'll figure that piece out, and that the deadline for submitting that written material would be close of business on September 14th. So at least you have an opportunity to receive it prior to the September 15th date. Remind them that there will be an opportunity to provide public comment on September 15th to the board, and that the board will, based upon the written submissions and the comment received on September 15th, will determine how they're going to proceed forward with this process. Does that sound like that addressed? I took notes here. I think that's hit everything that everyone has said. Does that sound like that'll work?
That sounds like a good summary to me. I see nodding heads.
I see Ms. Jones has weighed in on the material being sent to me and not her, so I'll make that change.
Okay, anything further on this item? Okay, doesn't sound like it. So we'll go to item 9A, County Administration Announcements.
Thank you, Chair. And I know we're getting close to the noon hour. We don't have anything after this. So I just had a couple updates. One, I was going to provide a brief overview on elections process. I know that this has been a bit of a hot topic nationally regarding some questions and concerns about potential changes by the U.S. Postal Service. We've gotten some emails and social media traffic just inquiring about Oregon's voting process, and specifically here in Lane County, what we do. And so I thought it would be helpful if you'd like me just to take a minute now, Chair, to provide some of this information. And if there's additional questions or comments, I can follow up on that. Wanted to note that statistically for Lane County, we all know that the state of Oregon has had vote by mail since, I believe, 1995. So 25 years of a really tested and a proven system that is both secure, accountable, and accessible for the public. In Lane County, about 70 to 79% of ballots are returned via our Lane County elections ballot drop boxes. We have 20 ballot drop boxes scattered throughout Lane County, in the metro area in Eugene and Springfield, to Florence and Veneta and Oak Ridge and up and down the I-5 corridor. So there are 20 drop boxes, and these are secured drop boxes that are available at least well over 2 weeks, I believe, 2.5 to 3 weeks in advance of actual election day. We collect ballots from each of those sites regularly, and we have a very secured plan that we, under state law, under ORS We do not share what our security plan is for collections or monitoring of those because state law protects that information to ensure the security and integrity of the collection of all of those ballots. But we have I'll just share with you that we have a very detailed security plan for all of our drop boxes. In the November 2018 election, 140,328 ballots were dropped in our Lane County ballot drop box sites. That's 79% of all ballots received in November of 2018. In that same election, 37,685 ballots were returned via the U.S. Postal Service. That represents 21% of the ballots received. So there's only two ways you can return a Lane County ballot. You either put it in a drop box, including if you bring it to Lane County elections, that is considered a ballot drop box site, or you put it in you put it in your U.S. Postal Service mailbox or drop site. In the November 2016 election, there were 140,186 ballots left put in a Lane County drop box. That was 72%. There were 47,587 ballots that were submitted via U.S. Postal Service. That was 25%. And 47,587 were taken to Lane County elections, again, which is considered a drop box. So ballots are mailed 20 days before the election, giving voters approximately 18 days to complete their vote and turn it in once they receive it. Each year, voters are encouraged to vote early and return their ballots quickly. Our elections team, Cheryl Betchard and her team, along with Devin Ashbridge, our public information officer, do an incredible job of providing public information via social media and television and newspaper about returning your ballot early, the ways in which you can return it, and then tracking your ballot. If a voter chooses to return their ballot via Postal Service, U.S. Postal Service, and do so 14 to 18 days ahead of the election, that leaves more than ample time for the ballots to make their way to elections ahead of the 8 p.m. election deadline. So again, it's when we receive it. So for the roughly 20 to 25% of Lane County voters that have historically turned it in, their ballots in via the post office, we encourage them to submit it 14 to 18 days, if they're going to mail it in, 14 to 18 days ahead of time. Of course, now state law allows for we have free paid postage or prepaid postage. And so it doesn't cost a Lane County voter anything. They don't have to put additional postage on to return it. The blue USPS collection boxes have received a lot of attention in recent days. It's worth reminding folks that any home or workplace that receives mail from the U.S. Postal Service can also send mail from that address. And the majority of our voters have that option. So it's not only those, for the 20 to 25% of voters who are returning it via the post office, the majority of our voters have the option to submit it via their home or their workplace pickup. We also encourage voters to contact elections directly if they do not receive their ballot in a timely manner, and our election staff will work to ensure that each eligible voter receives their appropriate ballot. I just want to stress this. Mr. Rickoff and I talked to our our county clerk, Cheryl Betchard, this morning, and she stressed the point that our election staff will work with voters to resolve any individual. There are all kinds of issues that arise. It's limited, but there are varying types of issues. When you look at, I think we have 200, I can't remember the number of registered, but I think it's around 240,000 in the last election registered voters. The vast majority there aren't problems with. But there are, occasionally minor issues with people not receiving their ballot or not returning back. And so we track that. We encourage folks to contact elections if they have any concern or any issue, and we work, our staff does an incredible job of working to resolve all those issues. And I will just conclude here by saying that if voters have a concern, the best thing to do is go to www.oregonvotes.gov, and you can track. You enter your name and your information as a register. That's where you register to vote. If you're already registered to vote, you'll come up and you can track your registration. You can track when your ballot gets mailed to you. You can track. You can verify registration, verify that it's been mailed to you, and you can track when the ballot has been returned. So when you return the ballot, you can go on the website and verify whether or not Lane County Elections has actually received that ballot. And if we haven't received it and you have questions about that, you can contact. So there's a lot of ways. I just want to provide that. We'll continue to provide this information. But we have we know there have been some concerns about the Postal Service. Thankfully in Oregon, and particularly here in Lane County, we have an incredible, secure, accountable, transparent, and accessible election system that ensures that every registered voter has the opportunity to cast their vote and for it to be counted and secured. So I'll stop there. If there are questions, happy to answer those now or get back to you with additional information. Since we're up against the noon hour, I think I'll just end with that.
Commissioner Bernay.
Yes, would that everyone in every state had that in place. Again, as one who raised concerns with Ms. Betchart and Mr. Mokrahysky, amid all of these things we're hearing about the post office not being able to deliver nationally, blah, blah, blah. I want the public that voiced those concerns to me to know that I'm thoroughly satisfied. I've explored it. Ms. Betchart has graciously given me the data I requested, etc. I would also just like to share, and this is a news headline. It's always suspect, but it's right out of the Wall Street Journal, and it just hit, which is that the United States Postal Service is going to suspend the changes until after the election. According to this headline, equipment will stay in there. And no more mailboxes will be removed. So hopefully what we're seeing is Lane County is in great shape, and maybe this country will be in better shape than many have feared. Thank you.
Mr. Bosevich.
Thank you. First, just Steve, I want to make a quick correction. Having prepaid mail doesn't mean it doesn't cost the voter anything to mail in their ballot. Somebody pays for that prepaid through their income taxes or some other tax that the state's paying that. So nothing's free. Just want to say that, Oregon's vote by mail system has some great superiorities to some of what's been implemented in other states. One of which is the fact that it's received by the close of the day on election day versus postmark. New York is learning very quickly that postmarks don't work for when a ballot is valid, because sometimes those postmarking machines aren't legible, or they don't even strike the envelope in the right place or something. And they got a bunch of ballots that they don't know whether they were postmarked accurately or not. And there's a huge legal argument about whether they should be counted. And there's still 2 congressional races that haven't been determined in New York because of that. The other thing that Oregon does that other states may, have not implemented fully is our ability to verify that the ballot received in that ballot box or by mail came from the voter it was sent to by signature verification. That is such an important piece of election security. And I think is something that needs to be done nationally to make sure that we keep the integrity of our election. The one thing that mail-in voting doesn't prevent, though, is electioneering at time of filling out ballot and privacy of filling out ballots. And that's the only, minor problem in our system. when we had polling places, you weren't allowed to have signs or, promote certain candidates or measures within so many feet of a polling place because they didn't want folks feeling influenced as they went in there. And you go into your booth by yourself without your spouse or any other family member, and they have no idea who you voted for. Mail-in ballots, though, tend to be received all on the same day in the family mailbox at the household and could be collected by a dominant family member and basically instruct the rest of the family how they're going to vote around a kitchen table. And that is the one place where mail-in balloting doesn't really do well, is your ability to have privacy from family members and household members in your voting. But I do believe that Oregon does it well. Lane County's system is secure, and that folks can count on getting their ballots counted. And they know that folks at mail-in ballots will be verified that their ballot actually came from them because their signatures will be checked. Having run a close election, had to go back and help people whose signatures got bounced. I found out that more often than not, it was a spouse that signed for a spouse when they were taking their ballots in and realized their spouse forgot to sign the ballot. And that vote never got counted because they didn't want to admit to the crime of signing somebody else's ballot envelope. So it's a good system, and I think it's not perfect, but it's better than most. And if the rest of the country could adopt at least the received versus no postmarks and the signature verification process, I think I'd feel a whole lot more comfortable about the national election.
Commissioner Sorensen.
Thank you. I think this discussion is good, and I really appreciate the hard work of our election staff and also the confidence that most people in Lane County have about the way our state election law and voting is administered. But I think that the reality is we have a dictator as president who thinks he can do anything he wants. And he recently admitted on last Thursday that he opposed funding to the Postal Service in order to make it more difficult to deliver mail-in ballots. And I think this is appalling. And I know that my constituents are just outraged by not only the comment that the president would say this, but also that he's directed negotiators with the COVID-19 legislative package to delete necessary funding for the Postal Service. And although vote by mail is very important, it pales in comparison to the life-saving component of the Postal Service, unless we forget that literally in Oregon, millions of people depend on the Postal Service and business depends on the Postal Service. So to have our president in this dictatorial fashion say he's going to depress voter turnout by underfunding the post office, I think is just atrocious. And I'm glad that people have riled up against this president for this, because 90% of the American people support the Postal Service and recognize the significance of it, whether for vote by mail or for receiving medications or for many, many other really important functions. So I'm glad people are upset about what this president's been not just saying, but what he's been doing to undermine the Postal Service. And fortunately, we have in Oregon a very well-established not only vote by mail, but also vote by drop-off to county drop-off boxes system that people can use and be confident that their ballot will be handled with utmost care. And I personally encourage everyone to drop their ballot off at a ballot collection stop as soon as they possibly can after they receive their ballot. And one other thing, I've had a lot of constituents over the years get letters or missives or phone calls from the Lane County Elections Division because of signature problems or because they didn't receive a ballot and then they called. And the election staff is doing everything they can to make sure that anyone who is eligible to vote and wants to vote can vote. And I just appreciate all the good work they're doing. I just hope that this most recent dust up nationally will not affect people's confidence in using the Postal Service. Thank you.
Well, thank you with all the comments. I agree that I feel very confident about our election staff and getting our ballots in here. I also think that there are some significant issues with the United States Post Office Service nationally that they will have to work out. We don't necessarily have much effect on at the commissioner level, but here locally, we're lucky to be very well versed in mail-in ballots. So thank you for the update, Administrator. And if there isn't anything else, we will we don't have an executive session this morning, but we do this afternoon. And a reminder, when we leave our afternoon session to go into executive session, we'll remain in executive session for the remainder of the day, but we will most likely come back out and it will be recorded for the public. Is there any other business for this morning? Okay, seeing none, we are in recess until 1:30. Thank you.